Hello. Our topic for today is Israel's very special process for deciding what benefits will be included in national health insurance. Our guest is Chaim Hoffert, who is a Deputy Director General at the Ministry of Health. Welcome, Chaim.
Thank you very much for having me, and good morning.
Good. Chaim, let's get started. Tell people a little bit about your background and your current role.
My position now is that I am the head of Directorate of Economy and Innovation in the ministry, and my previous position was I was the Deputy Director General for Planning, Budgeting, and Pricing in the ministry. And in the last 10 years, I'm working in the Ministry of Health. I'm an economist by training. I learned in the Hebrew University, and I did most of the very important economist position in the ministry for mental health, geriatric, innovation, and regulation.
Excellent, excellent. So tell us a bit about Israel's process for deciding what new technologies to add to the basket.
This is a very unique process. I think that there is no country in the world that have this kind of very structured process, which is not only structured but also very transparent as much as it can be. Each year, I think in February, the ministry is publishing an open suggestion to all of the Israeli citizens, pharmaceutical companies, and who wants to submit a new technology for the national health coverage. And each one of us, you, me, and everyone can submit a new technology. Most of the technologies are being submitted by the companies, but we can see each year we can see some technologies who are submitted by physicians or by unions or even by simple citizens. The reason for that, it's very hard to submit. You shouldn't only submit. I want to add this pharmaceutical or this technology. You should submit also the evidence that have this technology. But still, we see some of submission by simple citizens. I think that we have between 100 and 200 submission each year, which is a lot. Sometimes it's the same technology that we still have in the national coverage, and we want to broaden for new disease or new element. And sometimes it's a new pharmaceutical, new equipment, new technology that we don't have in the basket. And the process works like that. After you submit the technology, we have a unit here, a big unit that do a technology evaluation, which include not only if the technology is safe or it was approved, if it was approved by the FDA or the EMEA, which is the European Union organization, but also evaluation regarding how it was presented here in Israel. We have experience here. What is the opinion of the unions? What is the opinion of the people who use these technologies? And this process of preparing this I would say the book that we have a committee, which I'll explain in a second. We see the book that we see. It would take 4 or 5 months because each technology should have the same amount and the same structure of technology evaluation. And after that, in September, the Ministry of Health and the Ministry of Finance, they are appointing a National Health Basket committee. This committee, the structure of this committee is very unique. It includes 4 physicians that were represented by the HMO, because each HMO in Israel, Clalit, Maccabi, Leumit, and Muhammad, sending mostly the chief medical officer of the HMO to be part of this committee. 4 physicians that are being chosen by the Ministry of Finance and the Ministry of Health, who represent a broad aspect of the medical issue in Israel. It can be oncologists, it can be urologists, it can be psychiatrists. It depends each year. It changed. We have two economists for the Ministry of Health. This was my position in the last 5 years, and two other economists for representing the Ministry of Finance. And we have four public figures. It can be former member of the Knesset, a rabbi, a former judge, an ethical person from a university, and other professors. And we have a chairman. This chairman will be mostly a very high position physician from hospitals or from university. In the last 3 years, we have Professor Dina Ben Yehuda, which is a hemato-oncologist from Hadassah. And we have the administration of the committee leading by in the last 25 or almost 30 years by Professor Osnat Luxemburg. She is the coordinator and the main figure in the committee. And we are starting our day in the committee at 7 a.m. and we're finish it in most of the day in 4 or 5 p.m. And the structure of the committee, it's structured like that. The first phase, which is between 12 to
Wait. Let's stop a minute, Chaim. What is the mandate of the committee? Could they approve everything? Could they approve everything they think that'll help
yeah,
people? What's the
you're right.
framework here?
The framework that the government gave is giving to the committee amount of budget in the last 3 years.
Oh, that's part of what's unique here, right?
Yeah, 650 million shekels that the committee will recommend to the government. This is the number of technologies costing 650 million shekels that we recommend to add to the national health coverage.
Okay, so and they'll specify which medications or technologies, not just the number. So, are their recommendations usually accepted?
Most of the time, I think that was only one time that the government changed, because you have to understand that we are going to government, we are showing them this is the list of the technologies. It's very hard to the government to decide, let's take this out, let's take this in. We are trusting you as a very esteemed members of committee to give us the best recommendation that we can. So most of the time, I think, except one, the recommendation was accepted entirely.
Okay, now are there debates within this committee, or is it mostly, oh yeah, the technical staff did its work. Let's just take the ones with the best benefit
Mm,
cost ratio. It's rubber
No,
stamp.
the
No?
debate in the committee, it can be regarding if the technology is safe, or if it does what it's meant to do. It's
Okay.
if it is good if it's good more than what we have in the basket, because we have technology in the basket. So this new technology, it's better or not better from what we have in the basket, because
So
it
that's debates about individual technologies. Are there more principled differences about what's important when trying to
yes.
trade off
We
between
have
what the
1 year that I think 2 years ago the committee started and decided we had a war in Israel. We know that mental health can be a very big issue in the Israeli society. Let's put our effort to recommend most, or at least let give a precedence to mental health technologies, or for diabetes treatment, or chronic disease, or
Okay, so those were things that had a consensus. Can you give me an example of something where there was a debate within the committee, not a technical debate, but a principled debate?
it's from my perspective at least, the cost of every technology can be very high. So, for example, if we have technologies that doesn't really change the life of a person, it's prolong his life. He will still die from this illness, and it will cost more than 2 million shekels each year. I would say it costs a lot of money. We can't send this message to the companies that we will, as a country, will pay this amount of money, and it will be a big debate because there are physicians in the committee. People in the committee will say, yes, we should pay this amount of money, but this is a principle that how much we as a country will pay for medical device or pharmaceutical technology that only prolonging life, giving this amount of month, and also
If I understand correctly, some people might put more emphasis on the length of life, and some people might put more emphasis on the quality of life.
yes,
Is that it?
and also how much does it cost? Because you can pay a lot of money and get 10 months, and you can pay less money and get 6 months. What do you prefer? Do you prefer to pay less and get more technologies in this recommendation, this list, or to pay less or to pay more and to get less technologies in the basket?
Okay, our time is almost over. Could you please share with me one thing that you think is really good about this process and one thing that you think could be improved?
I think the most important thing that there is a trust between the population of Israel, the citizen in Israel, and the professionalism of this process. It, People know that we have this amount of opinion. We know that no other interests or private sector issues will blend in with this recommendation. And I think this is very important when you do a moral decisions in public policy. One thing that should be improved and being improved in the last 5 or 6 years, it's how we as a member of the committee will hear more the public, how we not as like a manifestation outside of the room, but how we see. Okay, we have what we have in the journal, or in the magazine, or in the research, but sometimes we have real world evidence from patients. So how we can hear them more. This is very important for me. And in the last 5 or 6 years, we have a pilot. So how we broaden this pilot.
Okay, Chaim, thank you so much for being here with us.
Thank you.